Next step, I think we're going to talk
Right,
about is the
and
backup plan, right?
so you need this backup plan. So let's click on it, and you can. These employers need to plan for times when their primary assistant is not able to work, and you need to identify all your options. This is ultimately for your best interest, right? The health authority requires you to show them a backup plan,
Yes.
but at the end of the day, this is really about you.
Yeah.
If you don't, and it's one of the areas that I think a lot of people get nervous about the Cecil program because they're worried about what do if an attendant doesn't show
Yeah,
up.
that's right.
With the agency system, if an attendant calls in sick, they have a pool of 100 people they can call upon and send somebody over. They may not always be. They may not always be the ones that you want to have come necessarily, but at least someone might come, right? So on the Cecil program, you need to put some thought in your backup system is going to be. So creating your backup plan, let's see what we got for the next PowerPoint here. So I should say we want to write this down so that you've got a complete process. You first of all need to determine how many attendants or personal assistants that you're going to need, right? So if you're somebody, and let's just talk part through, it's not part of the backup plan. Let's just talk about, that Excel sheet that we had, right? I made it really simple, that Excel sheet, where Anne, a woman named Anne, was working 2 hours a day, 7 days a week. Well, employment standards doesn't allow you to have that same person 7 days a week, by the way. I just did it for simplicity, okay? So continuing on with the at the moment, we'll go back, and Anne works Monday to Friday, 2 hours a day, right, doing the morning shift. And, you need to work out how many employees you're going to need because you're allowed to have Anne come back to do the dinner shift as well. Maybe your dinner shift is from 4 to 6. So let's say you get up in the morning and your morning shift is from 7 to 9. And then comes back and does the 4 to 6 dinner shift, right? And of course, on the Cecil program, you can negotiate all of those with Anne. If you want her to come a little later or whatever, a little earlier, you can always on the Cecil program, and you don't have to call anybody. You call Anne directly, right? That's a huge thing. So with the backup plan here, So Anne can only work within a 12-hour period, right, to have her called back without having to pay her overtime, right? So she can do the 2 hours in 2 hours, but they have to be completed within a 12-hour period.
Oh, I see.
Okay? So if she's coming from 7 to 9 in the morning, that means she has to finish up her job by 7.
By 7.
So you can have her come from 4 to 6, 5 to 7, whatever you do negotiate, right? If she lives close by, you will have a relationship, right? And you just kind of work things out with your employee, right? So in this particular case, person does, let's say Anne, does 5 days a week. She does those 2 shifts, and then you have another person that does it 2 hours at nighttime, 5 days a week, right? So now you have at least 2 employees, right, that's working, and then you've got your weekend employees. And you probably, let's say, have same kind of system where, another person does the morning and early afternoon, or the 4 to 6, and another night person. So right there you have at least 4 employees, right? So your emergency backup system should be automatically your employees.
Yeah.
Right? That should be something that you already have when you hire them.
Right.
That you ask them, what other days are you available if I need you? So maybe Anne does that Monday to Friday component, right? But can she throw in a Saturday from time to time if need be, or a Sunday, right? Kind of thing.
Is that normal? I mean, that positive replies, or is that?
Absolutely. I would say that if you have a regular person, quite often they would love the extra hours.
Okay.
Sometimes it just depends if they're working somewhere else or doing other things, right? Or if they got family or whatever. But quite often they're comfortable with your routine. It's not that big of a deal for them to do that kind of thing. Keep in mind that it depends where they live and how far they're And obviously later on when we talk about staff and stuff, talk more about areas of where they live and stuff, and do they drive or do they not drive? Those kind of things.
Yeah, that's a big part of developing a relationship also with on the professional side of it, but also the human side of it too. So.
Exactly. So first of all, you really do want to determine how many people are on your system already. What are they covering? And then having them as part of your backup. Let's go ahead to the next slide, which kind of goes into thinking about things. So in this case, this person has 3 staff that will cover the 7 days a week. So this is how you're going to talk about it and think about it. If one is sick, I will contact other 2 to see if they can come in. If these 2 options fail, I have a list of friends on CISO who are willing to share the backup staff. Peer support. This is where peer support is important. We at the Individualized Funding Resource Center are looking at developing peer networks and stuff, and we're going to be partnering with Spinal Cord Injury BC and all the other organizations out there around, really trying to get people on the CISO program to get together once in a while and brainstorm and talk, and at the same time, by meeting each other, you can share your staff amongst each other, right? The next, then there's, I have 3 people among my family and friends who do some basic tasks for me in an emergency. So this is a real, just basic, solid emergency situation. But maybe you don't have that and you don't put that in.
Right.
I should also, one of the things that I haven't even listed here, before we even go to an agency, is that the Individualized Funding Resource Center does have a pool of staff. We have about 100 employees that are part of our system now. And so, it is an option. We don't provide emergency backup, but we do provide the ability for you to give us a call and say, hey, I'm going to need to replace my employee. Right. This is the kind of person I'm looking for, and the resource, you list of 4 or 5 to interview. That way you don't have to start from scratch, right? Will we do emergency stuff? Yeah, we're doing emergency stuff too, because the reality is we get ourselves caught in situations. So we need to figure out better systems of how to deal with emergency. But with having 100 staff, we're starting to get to know them really well, and there are some people that can jump in for us and help out. So keep that in mind. Keep that in mind. So backup. So at the end here, number 5. So really, individualized funding should be up there. Number 3, number 2 kind of thing in there, right? I know we don't want to go to our family and our friends to really do some of the intimate personal care stuff, right? But we got to do what we got to do to make it. The number 5 was having an agency system in place. So you can go to an agency. The reality with an agency is that it'll be anywhere from $25 an hour to $35 an hour. It just depends on the agency. But my recommendation is to actually have a conversation with an agency, talk with them, work out an agreement with them for backup purposes, and then that way you've actually got it all taken care of. You'll have to deal, and trust me, an agency that you're paying directly will respond to your needs differently than through the health authority system, right? So you shouldn't be scared about going to an agency. It would just cost more to go with an agency system. And I got to reiterate that this is only for emergencies. You can't. The program doesn't allow you to use agencies on a regular basis. It is just for emergency purposes.
All right. So how would they find out if you're using?
Well, good question. They'll find out because you've got to report where all your dollars go. And later on, we're going to be showing you a monthly statement.
Yes, we will.
And that monthly statement will indicate where all your monies goes.